All right, today we are digging into a real-life scientific detective story. We're reopening a case that was officially slammed shut by a major medical journal way back in 1998. And it turns out, the real story was hiding in plain sight, just buried in the data for over a decade.
You see, the original study concluded that a couple of common pain treatments were basically useless for a group of very sick patients. But that conclusion, well, it wasn't just wrong, it was dangerously wrong. And when a new team looked at the very same data with fresh eyes, they uncovered something absolutely startling. So, let's rewind. Let's go back to the beginning of our story. This starts with the official conclusion, the finding that the entire medical community just accepted for years. Okay, here's the timeline. In 1998, a big clinical trial gets published in one of the world's top medical journals. It was testing treatments for this really painful nerve damage in HIV patients. The conclusion seemed totally clear. Neither acupuncture nor an older antidepressant called amitriptyline, which is often used for nerve pain, gave any significant relief. And just like that, the book was closed on this.
And this wasn't some wishy-washy finding. The researchers were totally explicit about it, stating that neither treatment had, and I'm quoting here, any effect on pain relief. It was as definitive as you can get. A nothing to see here, folks result, published and filed away. But then, more than a decade later, a new team of investigators decided to pull out that old evidence. They just had a hunch that maybe, just maybe, something important had been missed.
So in 2010, two statisticians, Samuel Shiflett and Gary Schwartz, they got their hands on the original raw data. They had this suspicion that the 1998 conclusion of no effect wasn't because the treatments didn't work, but because the original statistical analysis, well, it just wasn't powerful enough to see what was really going on. They believed the truth was still in there, just waiting for the right tools to come along and uncover it. And here is the central clue. The original researchers, they had this really elegant plan, what's called a 2x2 design, to cleanly test two things at once. But they really struggled to find enough patients, so they ended up having to combine data from 3 different study designs. This messy combination forced them to use a less sensitive statistical method, one that couldn't really pick up on subtle but crucial interactions. It was kind of like trying to read the fine print with blurry glasses on. So our new investigators put on a much sharper pair of statistical glasses, and the very first thing they looked at was the study's main question: what about the pain? I mean, that was the fundamental question, right? Did these treatments actually do anything for the patient's pain? The original studies said a clear no. But the reanalysis was about to tell a completely different story. And boom, here is the first bombshell finding. Using a more appropriate analysis, this hidden interaction effect just popped right out. What this table shows is that both acupuncture and amitriptyline were effective at reducing pain, but only when they were used by themselves. The moment a patient got both treatments at the same time, the positive effects just vanished. They were completely canceled out. So it wasn't that the treatments did nothing, it's that together they did nothing. But the mystery didn't stop there with pain relief. This bizarre interaction where the two treatments seemed to cancel each other out, it showed up in another really critical piece of data. Okay, so to understand this next part, we need to know a key term, attrition. It sounds technical, but it's really simple. It's just the rate at which patients drop out of a study. And you gotta know, a high dropout rate is usually a big red flag. It could mean the treatment is unpresent, has bad side effects, or it's just not helping. Now, just look at this chart. The results are pretty dramatic. The patients who only got acupuncture had this really low dropout rate, only 13%. They were sticking with it. But now look at the other groups, the ones who got the drug amitriptyline alone, or both treatments combined. Their dropout rates were over 3 times higher. This suggests that acupuncture by itself was having a really positive effect, making patients feel good enough to stay in the trial. But just like with the pain relief, adding the drug seemed to completely wipe out that benefit. And this is where our detective story takes its most serious, most sobering turn. The reanalysis uncovered a pattern that went way beyond pain and dropout rates, a pattern with literal life and death consequences.
The statisticians decided to dig even deeper, and they focused on the most vulnerable group, patients who were already in poor physical health when the study began. Now, you have to remember, this was back in the 90s, before we had the really effective HIV treatments we have today. And what they found here, it was the most shocking discovery of all.
For those patients who were in poor health and received only acupuncture, the mortality rate within 2 years was 11.1%.
So let that sink in. Acupuncture alone seemed to have this powerful protective effect. But what happened to these exact same vulnerable patients when they received acupuncture and the drug amitriptyline at the same time? The mortality rate skyrocketed to 52.9%. I mean, just think about that. For the sickest patients, the combination of these two treatments was associated with a nearly 5-fold increase in the death rate compared to acupuncture alone. This wasn't just some quirky interaction, it was a potentially fatal one. That original no-effect finding had been hiding a truly devastating signal this whole time.
So, what do we take away from this incredible story? I mean, the reanalysis of this one single forgotten study actually offers some really powerful lessons about science and about medicine. Well, for one, this whole story shows that having the right statistical tools is everything. A flawed analysis can literally hide the truth. It's also a pretty stark reminder that treatments can interact in ways we don't expect, sometimes dangerously so. And it proves that a no-effect conclusion should maybe sometimes be met with a little suspicion. In the end, the researchers said this should serve as a yellow flag for doctors everywhere, reminding them to always be on the lookout for potential interactions between drugs and other therapies. The craziest part is that this whole story was unlocked from a dataset that was just sitting there, publicly archived, waiting for someone to come along and ask new questions. It really makes you wonder, doesn't it? In this age of big data, how many other closed cases and forgotten studies are just sitting out there, holding secrets that could completely change what we know about health and medicine?